welcome to the Female Entrepreneur Series. And I've created Wallet to Wealth about 1.5 years ago, which is a brand to speak to women, to really help to educate and allow them to lead empowered lives. So we have monthly events, and we also have weekly speakers every Monday morning at 10 a.m. And we bring a female entrepreneur who has a service or product that will really keep you in the know and help you to live a better, healthier, and empowering life. So just briefly on Wallet to Wealth, and if you can forward, if you're able to forward that over for me, were you able to forward that over to me for me, Janice?
I sure tried.
Okay, so
I sure tried.
So with Wallet to Wealth, we had 7 events last year, and the 7th event was our inaugural dinner event, kickoff for the Women's Abuse Prevention Month in November. We were able to raise $15,000 for Halton Women's Place. And so this year we'll be doing the event again, November the 12th. So mark your calendars. It's going to be a virtual event. And we actually feel that it's going to be better because we'll be able to reach out further and bring you these female speakers who will be talking about how they found advantage in their adversity. So how they built really great businesses, and how they, you know, from difficulties in their life, they were able to provide really good services in businesses. So that is November the 12th. And our plan is to raise $30,000 for Halton Women's Place, and I really think we're going to do it. So join us. So today I'm really excited to introduce you to Janice Holmes from HealthSCAN, and I've known Janice for, I forget how many years. It could be up to 10 years, and she owns a business that is near and dear to my heart. I use this service, and I will always use this service. So I highly, highly, highly recommend this. This is for your health. Janice found out about infrared thermography, which I had already known about, and I had already done this many, many times through another service. But she has a service that is in Burlington, and it's not moving, because a lot of them, they'll just come in and do the service for 1 week, once a year. She is land-based and stays there. So a huge welcome, please, everybody, for Janice and Jan. Welcome.
Thank you very much, Whitney. I'm very happy to be here, and glad to be a part of this wonderful journey with you.
Awesome. So I'm going to ask you a couple of questions, so it will help for the listeners to hear about who you are and how you actually came to this business. Because many of us we create a business because of something from some frustration, whether it be a generational trauma situation or whether it's a societal message. So give us some information around that.
Well, Whitney, I started in healthcare about 30 years ago. It may have come from the influence of my parents. My mother was a nurse. My father was a self-business owner, entrepreneur. So I guess that combination has found its way to being here. But when I was in healthcare, I was an athletic therapist. I was involved in the rehabilitation and treatment of people with injuries, and it was wonderful. I enjoyed it, but I did notice there was something missing. So we would go through the rehabilitation, we would communicate with the doctors, and there always seemed to be a missing link. So of course you educate, you try to do more, you do this, and always for the benefit of the outcome, and there was still something missing. So what I noticed, I think mostly, is that our healthcare system, and not always, but it's more of a reactive type healthcare system than a proactive type healthcare system. And so what when I was ready to make a change, not completely away from healthcare, but still in healthcare, I wanted to be part of the change that was going to make it in the direction that we were missing. So filling in that medical gap. And that's how thermography came in front of me.
That's, that's amazing and it's true. So I just want to reiterate what you said about reactive healthcare versus proactive. Okay, so what that means is that we go to the doctor because there's something going on. And by the time we get to the doctor, this something has been brewing for a while. So it's really, really important. I've been practicing proactive healthcare for probably a dozen 15 years, and it just makes such a massive difference. I could, it just does. So I wish this for everybody, and of course we'll keep giving tips on how to have proactive healthcare. So for you, it sounds like some frustration there, that thing was being seen or looked at in the facility that you were working in, and also in, your mom came from healthcare environment that was frustrating you. So that actually then catapulted you into saying, well, gee, there's got to be a better way. Like, how can I serve people better? So that leads me to my next question. Tell us how you became aligned, so that disadvantage of what you saw people going through, how that's really brought you to an aligned life today.
So what I noticed was the align or the evaluation was more a singular focus. So let's focus on the area that's hurting. Let's not look at any other area. There may be some correlation, there may be something adding, and in rehabilitation, we're taught that to look at the global picture, but it just wasn't quite enough. So the other thing that's very difficult is to see what's happening on the inside when you can only look at the outside. So when I could see the frustration in the clients as they were coming in, I could hear the frustration in their voices. I've been here, I've tried this, I've done that, but they're all staying in the one area and they're not looking at anywhere else. And so this is where I really wanted to add to that. We're a generation of advocates for our own health. We, the generation before us, it was very much listen to what you're told and do what's told then. So it was all about just follow the dots. Whereas now we step forward. Most of us have more than just a physician. Most of us have a healthcare team. So we have a chiropractor, we have a massage therapist. I know you have more and more and more, but a lot of us have this, and it's a unified service rather than a singular focus. And that's where thermography can come in. We can see what's happening on the inside. We can let you know how to take that forward to your different healthcare practitioner. And hopefully it's that missing link instead of that singular focus.
I just love it. So tell us about HealthSCAN. Tell us about your business, what you do, and how this can help people.
So thermography, just to go an overview, because a lot of people may not know what it is. Thermography is a non-invasive radiation-free imaging, and it's detecting blood flow changes or vascular organizational changes causing heat, abnormal heat within the body. And we use an infrared camera to detect these changes and map it out in a report that's sent to be interpreted by medical doctors who will give us the information back. We offer a full body scan, which is what I believe everybody should have, because it gives you that full baseline of health. The full body scan is from the face to the toes, and we're looking for any changes within the neurological, within the dental, within the sinuses, to the thyroid, to the chest, to the breast, which can be a key area for a lot of women and a lot of people. The back, the abdomen, so the digestive, the gut health, the lower pelvic floor, so for the men, it's the prostate. For the women, it's the uterus and ovaries and bladder. You know, the back, the kidneys, the colon. So we're really showing a picture of how everything is functioning. Is it functioning normal or is it functioning abnormally? What is this key area that you need to focus in on? And is this something that you can use as you take forward with your healthcare? So we're really just trying to tell you what's going on the inside so that you can be proactive and find out or use that information as you move forward with your healthcare. It's not always the symptoms that make us feel unwell. So knowing in advance, knowing how things are working, you can do things before they become a symptom. You can address those risk markers, you can address those red flags, and with diet and exercise and all these alternative changes before.
Or biopsies.
Or biopsy.
Or biopsy, because
Right.
this scanning will show if there's something in your body that needs to be biopsied.
That's right. So with the breast, it is focusing on the vascular flow, the organization of the blood within the vessels. Is there new vessels being recruited to a change in an area? We're looking for all of these blood flow changes. Now, not always the hot spots. Everyone thinks of thermography is checking for hotspots, but it's not. We're looking for the cooler spots as well. They can be an indicator of an obstruction of blood flow or a different tissue consistency within and in the breast. That could be a calcification or a cyst or some sort of change that is different. So if we can see these changes before they become a mass formation or a vascular organization, then maybe we can do things in our own lifestyle to help void or stay away from anything further happening.
That's fabulous. So I just want to share my experience briefly. And I hope that we're streaming okay here because I keep getting an unstable. If anybody wants to comment on Facebook there, live and clear. So I think for me, it was 15 years ago. So I have an integrative, I shouldn't say always, I started with integrative medical 15 years ago. So an integrative doctor so I also have a regular family doctor, but an integrative doctor is one who will do all the, they're not, what was that word we used? They're not looking at
Not
what
mainstream.
is wrong. They're at optimal health. And I would say at 56, yeah. I've got optimal health. I've never had any surgery or changes to me except for, my appendix coming out. So this doctor, and I've had 2 of them, insist on breast thermography. So I've had breast thermography for 15 years. And I also, in that 15-year time span, I've also had 2 regular family physicians who were not aware of what thermography was. And they ask me every year, I need to have your thermography results. So the old doctor and the new doctor, because what they tell me is there's just too many women getting breast cancer and it's not getting picked up soon enough. on the mammograms. Okay, so and that's not to say don't get a mammogram. I've had 2 mammograms because I've had 2 marbles, and it was like, holy smokes, what's this? So I went and did that. But I just want to say that my experience has been over 15 years, has been fabulous comfort, because I get this test done, and the thermography, the infrared camera, picks up what's going on inside of my breast, my tissues, and it actually rates me as, you know, to where I am in my health, you know, whether I'm a candidate toward cancer or not, if there's any changes. There's a callback. It's the same radiologist reading my report. So I'm doing your speech right now because you do them for me, but it's the same radiologist who's reading my report. And in all the years of having them done, 15 years, there was one time with Janice that it came back and the radiologist said, listen, this and this and this is what we're seeing. And it happened to be at the same time when I ended up getting called for a mammogram. So it was all together. And then I needed to go back 3 months. They wanted to see this again on the thermography, and everything was cleared. But I'm telling you, my family physician was on this. My integrative doctor was on this. Like so what I just want to let everybody know is that if I had a situation of a breast cancer forming or already in, you know, it's already forming and brewing, I've got all eyes on it right away before it gets into the different stages. And for what you charge, Janice, for this test, it's unbelievable. So I explain that, but it's so we do have a lot of people watching today, so I encourage everybody to get involved with this. There's no radiation, there's no drawback. And how I found out about thermography was many years ago from a client of mine who has her PhD in sonomic movement. So she knows every single thing about the body. So this is really important. Sorry to rob your time.
No,
but,
that's okay.
Yeah, because I'm just such a huge fan, and I've just known far too many people who have gotten breast cancer and cancers. So what's fabulous, and again, just one other thing I want to share, and I'm going to let you talk, is that Janice did, again, like with the scans, 2 things I want to share. One was I had half of my thyroid come out, had to have it surgically removed. And I had 7 different biopsies, and they could not get a result as to whether I had cancer or not. And they need to know before they go in to do the surgery, because the surgery would be different. So anyhow, it was through the thermography that we did the test through my integrative doctor. And we came back, we said, you know, we can pretty much say that we just don't think this is cancer. So I was able to go in with my surgeon hoping that this thermography was correct, and it was. So I ended up with I ended up being able to save half my thyroid. Okay, otherwise they would have taken the whole thing out. So that was the one thing. The other thing is that I'm not sure if it was 5 years ago in the body scan. It kept coming up. There was something here with my jaw, and I'd take it to my doctor, to my dentist, and everyone's like, we just can't figure it out. We can't see it. And this February, it started. I've got excruciating pain in my jaw, and we are now into August. I've been to the dentist, x-rays, everything. So I don't have a dental cavity or anything like that, but we've got something going on in my jaw because it's been killing me for almost half a year now. I can't even chew on it. So, but this came up in the thermography. So the thing is that it forewarned me. Okay, so that's just what I want to share. It's your turn.
Exactly what you're saying, Whitney. It is an adjunct tool. It is a complementary type of scan that you can use to one, see how your health is, or you can use it to monitor an existing condition that you're aware of. Is there any progression? Or thirdly, you can use it to, if you know there is a condition, you're seeing a practitioner doing things to make it better, you can see if you're reducing what you're doing as well. So the blood flow all changes throughout these different scenarios, and that's what thermography is all about. It's monitoring your health, it's letting you know the red flags if you need them, and it's letting you know that you're on the right path. So you can use it in any way.
Yeah, what a great way to see inside your body. So Janice, how do they reach you? Should people see you once a year? What do you recommend? And then also, what do you charge for? I know you do just breasts. If people just want breasts, there's one fee
Right.
for that, and then there's another fee that would include your breasts, your entire body. So how does everything
Right.
work?
So we offer, like Whitney said, different types of scans. There's the full body scan, which includes a full breast series. And believe it or not, we do the lymphatic and breast for men as well, because men can get breast cancer. There is a wellness scan, which is from the pelvic floor upwards. So it's kind of, it's a little less than the full body scan, but it's giving you those key areas, basically from sinus to uterus, for a better way of putting it. So again, full breast series and looking at the core of your body. And then we do area of interest and breast. So the breast, includes the full frontal side and each breast individually, the lymphatic system as well, looking for all of those changes or abnormalities. Everyone has a unique fingerprint of how they look. So it's important to establish your baseline when doing the imaging. So the initial cost is for the breast, $250 plus HST. The wellness scan is $350 plus HST, and the full body is $425 plus HST. So very reasonable. The earliest a second scan can be done is 3 months, because we need that cellular activity and replication to happen before we can identify changes. And if you are to come back, your report will indicate when you should come back. But if you come back nice and clean and very healthy, then annual scanning is by all means enough. To establish that baseline, you need 2 mirror images. So with the breast, it's recommended you come back in 3 months to have just the breast only. And then from then on, it all depends on your health. So we're not waiting for symptoms, but if you want to come in annually is good. If you want to alternate, yeah, you can do that as well. With the breast, I do have women who have alternate with the mammogram, because it is giving a different view. Like you said, we're looking at vascular organization versus structural changes. I have women who have had surgeries or reconstructions, and so mammogram may not be of choice for them, so they come and see me for that reason. And women who've had augmentation that don't want to get the compression of the mammogram, thermography is a very viable option as well. So it's available for everyone. You can come in. My youngest client was 2 years old. I wouldn't recommend everybody to come in. She had a health concern, but for general health, because it's safe and there's no radiation, you can come in at any time.
Awesome. And for me, myself, I come in once a year, and yeah, and I don't miss that. In fact, a lot of times I reach out to Janice, are we at that year yet? Which I think is September. So
Yes, it is.
it's just so important. And again, because then it's you get to read it, your family physician gets to read it, you know, and if there's any changes, absolutely go get your mammogram. This is not a diagnostic. It's not going to come back and say, hey, you have colon cancer or you have breast cancer, but it will show that there's something going on there. And that's where you can go to your physician and say, hey, you know what, there's a red flag, you know, I've been having this or this, and all of a sudden, oh, look, it's showing this. So A plus B equals C, let's do something about it. So I just encourage everybody to please, please, please be proactive with your health. And Janice, I love your spirit, and I love your technical knowledge and your patience. You're extremely patient and kind. And I was having my like I said, I was having my scans done before I met you, they had these traveling services. So you had to fit into whenever the traveling service was, you know, in your naturopathic clinic or your integrative doctor's clinic. And that's fine if you're doing that, you know, people continue to do that. But if you can't, if you don't know anybody or you don't want the traveling clinic, Janice has her feet on the ground. She's at 2400 Brant Street in Burlington. I think you do a couple of other clinics, and we can put that information below in the messaging. So just go ahead and write to Janice. I'm sure she can take it over into private message so that whatever it is that you're discussing is private. I do see a lot of males currently right now on our live, and so this is why we stream on Whitney Hammond, and then we group, because in the Wallet to Wealth group, the streaming is private and all of the questions in there, only that group can see. But a lot of our services that we're talking about, we're finding that are just of equal importance to males. So we do encourage you to follow with us. You're most welcome. So for males and females, this service is fabulous. It's very inexpensive. My own healthcare provider, I don't know about other people's, but my receipt for my scan, my 275 for my breast. I don't do my full body every year. I can, but my breasts I always do every year. I just put that through my healthcare provider, and I'm refunded that money. I can't say what it does with other healthcare providers. Mine happens to be Benecade. I have a Great West Life and I also have a Benecade. So okay, so that we're just about to wrap here. So is there anything else, Janice, like what you wanted to share, you know, what's next, or if you just want to close off?
Well, no, what's next is we've certainly been through a health scare. So I just want to encourage people to take their health seriously, to take that extra step as far as being an advocate for your own health, being proactive. Feel free to contact me through either email janice@healthscan.ca, visit our website, healthscan.ca, on Facebook, HealthSCAN Thermography Clinic, on Instagram, you know, the whole social media platform. It's got to be done these days. But I just, I welcome anyone, any questions, anytime, and let's get healthy together. Know your health.
Know your health. I love it. Okay, so this is it. Thank you very, very much for being here today. And again, like I can shout it from the rooftops. I'm just so happy with the service that you provide and your commitment and how you came to, you know, with an adverse situation of saying like, there's got to be more to help people. And this is definitely not about cutting out family physicians in any way, shape, or form. It's actually to help them, because when you're starting to search, it's a needle, looking for a needle in a haystack of what in the heck is going on with my body. I don't feel well. And you know what? This happens to all of us. Sooner or later, we've got something going on. And so with the thermography, it can pinpoint that's where you got to look.
Let's just compliment everything and let you know ahead of time. That's it.
Awesome. Okay. So bye-bye, everybody. And we'll see you next Monday at 10 o'clock.
Thank you, Whitney. Have a good day.